Welcome to tonight's Cafe Scientifique at Stanford Blood Center. My name is Kevin O'Neill in the Marketing and Communications Department. Stanford Blood Center is part of Stanford Healthcare. Stanford Blood Center is the primary supplier of blood products to Stanford Healthcare, which is the second largest user of blood products in our nation, as well as to two other hospitals in our community. Of the approximately 70 blood centers in the United States, few have a history that includes research, as does Stanford Blood Center. The research facet of our mission has been a springboard for many scientific milestones and industry-leading discoveries which have been made here. Our success would not have been possible without our faithful blood donors, many of whom are here this evening. Thank you very much. Now I'd like to introduce tonight's speaker for our discussion on women in academic medicine. Dr. Jennifer Andrews received a Bachelor of Science degree from Florida State University. Had to say that for the record. In biological sciences. She received her MD from the University of South Florida, as well as a Master of Science in Clinical Research from Emory University. She is board certified in Pediatrics, Pediatric Hematology, Oncology, as well as blood banking, transfusion medicine. I was told that there are only 10 doctors in the United States with those three credentials. She has received numerous scholarships, honors, and awards. She has co-authored many peer-reviewed medical journal articles, as well as chapters in 3 medical textbooks. She currently serves as a clinical assistant professor, Department of Pathology and Pediatrics, Stanford School of Medicine. On a personal note, Dr. Andrews has a great sense of humor, as well as a beautiful quality of transparency. And I quote, "I love working with children because they are so honest and optimistic. A patient once told me my outfit didn't match. I looked down and saw that I had 2 different shoes on. No adult would have been that honest. I just love that about children, their honesty and their positive outlook." Please welcome Dr. Jennifer Andrews.
So I've actually known Kevin for a long time because part of my training was here at the Stanford Blood Center. So thank you for inviting me. It's lovely to come talk to you. On a personal note, I want to thank all of you as well. As a practicing hematologist, I prescribe a lot of blood products that come from this donor center. So thank you. You're saving lives every day. So I wanted to talk about a topic that's not sort of something I publish in or do research in, but personally, obviously, it makes sense that I'm interested in this topic. I wanted to give a couple of disclaimers. First, this is not meant to be a political discussion. I am not endorsing any presidential candidate during tonight's speech. I don't want it to be controversial. My ideas are just my ideas. They don't represent what Stanford University stands for, and I'm not mandating that you all write your congressman and ask for what I am suggesting. My goal in life is to serve as a role model for my young daughter, and my patients came first, and I've always wanted to be a good model as a pediatrician to children. And so now that I have my own child, it's with her future and success in mind that I framed tonight's talk. It's not meant to be, as my dad says, man-bashing. Okay, so the first thing I'm going to do is just review that actually everyone in the room, all humans, are biased. Probably in ways that some of us realize and others secretly hold biases. You may not even be aware of them. And I'm going to go through what was a surprising exercise for myself, a very successful woman. I took Harvard's implicit bias test, which is available online for free, so any of you can take it. And I'll go through my results. I'm not too embarrassed to share them. And then I'm going to go through women in academic medicine. So you would think in the year 2016 we've made quite a bit of progress, and we have, but we have a ways to go. Now here we are in Silicon Valley. We're surrounded by a lot of industries that actually have much further to go than medicine. So I'm actually a bit proud in medicine compared to some other very businesses that are very close to this building, actually. And then I'm going to go through my approach. How should we address the bias that's left in academic medicine against women? Because there is a bias. And I'm going to highlight Stanford's policies, which in general are quite progressive compared to other universities. And then I want to take it down to what can you do as an individual? What can we do to support medicine, women in academic medicine? And I think it's not exactly specific towards academic medicine, but rather supporting women in whatever career they are pursuing. So why am I interested in this topic? This isn't something I write about. This isn't something I did a fellowship in. This isn't something that, God forbid, my dad had to buy me another graduation present for. With like my 4th degree, he was like, can I just skip this one? I said yes. So I'm obviously a working woman. My mother was a working professional. She was a teacher. My grandmother was a chemist. So I come from a very long line of working women, and my grandmother got her degree in chemistry in the 1930s, which was quite unusual for the time. And she stopped working when she had children. She was pursuing her PhD and she never acquired it. So I feel like I went a little bit in my grandmother's footsteps. Now I don't have a PhD, but I continued the tradition of science. And I never ran into extreme bias, or I didn't recognize it, until medical school. So that was 20-some years into my education. And I went to medical school now more than 15 years ago, and these are comments that I have to say I still get to this day, unfortunately. When is the doctor coming in to see me? Are you a nurse? You're too pretty to know anything about this. These are real comments, and I would say I didn't put 100% because I didn't want to make such a blanket statement, but I think virtually every woman physician can give their own anecdote about these kind of comments. And they're so commonplace, and they still occur probably once a month, that I don't even register them in my mind anymore, which is a real shame. That really shouldn't be happening. And there is a known leaky pipeline to leadership, even at Stanford. And actually in some departments, we are worse than other academic universities. And I alluded to this, but there's been a lot of lay press, especially for the field of engineering, that shows a similar pattern. It's actually worse in that field than it is in medicine. So let's go through my objectives. So what is invisible bias? And I'm going to actually have you all watch a YouTube video after this slide to see if you have invisible bias. So it refers to the relatively unconscious and automatic features of prejudice, judgment, and social behavior. And recently it's become very sexy to do research in this topic. And it's focused on implicit attitudes towards members of traditionally socially stigmatized groups such as African Americans, women, and then LGBTQ community recently has been in the news a lot. And so I'd like you all to watch this YouTube video and see, and we'll find out if you guys have bias. We don't need sound for this. This is everyone, they think they saw it before. I think this is a new one. Yes? Do we see the gorilla? This is where people get tripped up, including myself. So I saw the gorilla. Thank you. So many of you guys have seen this in a previous format. It's pretty popular to show the YouTube video with just the gorilla. But so many people have seen that now that they had this new video out where you missed the curtain color change. So it actually changed from red to yellow. So that's visual invisible bias, right? You were paying such close attention to how many times the white players were passing the basketball back and forth, which is pretty apropos considering the Warriors are playing right now, but that you missed the gorilla and the curtain color change. So that's visual bias. So there's actually implicit invisible bias in thinking. And so this Harvard-led implicit bias test started off as a research project more than a decade ago. And they've had many publications. Their website is open to the public, and they're still actually doing active research. So if you go to the website, you can agree to be a research subject. And you can explore your own invisible biases regarding various topics, whatever you might be interested in. So you can look at your views about gender, race, other topics. And it's pretty eye-opening. I'm going to share my embarrassing results with all of you. So this is a screenshot of the actual website. And you have to identify how strongly you associate career and family with males versus females. How personally important is this to you? Do you have children? Did your mother work, etc.? They get a little bit of background on you. And then you actually are presented on your screen with words like home, parents, children, family, etc. And then a typical female name like Julia, Michelle, etc. And you have to quickly sort to which words match with which activity, okay? Unfortunately, my results show that I have implicit bias. So I have a strong association with male and career, and a strong association with female and family, which is shocking. All of the strong women in my background were working mothers. I'm a working mother, and I have this bias. I never thought this was true, but here it is. So I strongly encourage you all to take this bias quiz. It's pretty eye-opening. And they also share with you at the end of your test result what your data looks like compared to other individuals who have a similar background or are the same gender or the same race as you. And the majority of people actually have some kind of bias, either slight all the way to strong, association of male and career and female and family. So this is quite prevalent. Hundreds of thousands of folks have taken this test. So I think it's a pretty good cross-representation of views in America. This is just a distribution plot of 83,000 scores. And the more black the score and the higher the bar, the more implicit, the more biased that test taker is, that subject, towards male and career and female and family. So this is the majority of the 83,000 folks had that association, either strong or at least weak. So I'd like to think that this field of medicine is enlightened. So when we go to medical school, we don't learn that there are differences in basic things, basic physiology of, let's say, a red blood cell. Is there a difference in a male and a female? Of course not. That doesn't make any sense. When I go look at a chest x-ray of a child, is there a difference between a male and a female? Not in young childhood, right? I'm not taught about bias. But the answer is a little more complex than that. We're not quite as enlightened as we could be. So certain fields have more women than men, and I'm in one of those fields, pediatrics. The other hat I wear as a transfusion medicine doctor, though, I'm the minority. So most of my colleagues in transfusion medicine are men. I would say that at Stanford, most of the staff, especially when I'm working in the children's hospital, are quite accepting of the attending physician being a female. And I would say that probably other women in, let's say, male-dominated fields like orthopedic surgery or neurosurgery, they probably have more of an upward battle with their nursing staff, the surgical scrub techs, etc., than I do in a pediatric children's hospital that's a little more accepting of women and has been for decades. Obstetrics is probably similar to our experience in pediatrics, but probably everyone has unrecognized bias, and they're not making any, they're not having any action to correct that unrecognized bias, which is something I think we all need to do. So what does the data show? As a scientist, I'm always asking, what does the data show? I know what you think. I know you have an anecdote, but what does the data show? So this data is shared with Stanford through the State of Women in Academic Medicine. It's put out by the Association of American Medical College, or AAMC, of which Stanford is a member. And you can see it progresses through this leaky pipeline here. So we start at the beginning. Women make up almost half of applicants to medical school. Up until just a few years ago, they made up more than half of matriculants to medical school, but now we're at about 47% as of 2014. They make up about 46% of residents. So residents include interns, and actually that's when that mismatching shoe incident happened when I was an intern. Before we had work hours restrictions, and I was running from the ICU down to my clinic after working about 24 hours, and I had on 2 different colored clogs, and no one told me. It was the last patient of the day at 4 o'clock, and she said, your shoes don't match. So anyway, and then after you finish the torture that is your intern year, you become a resident. So about 46% of residents are female. And then already there's a leak from residency to faculty. So only 38% of faculty at academic centers are women. So some of those women are obviously going into private practice, etc. There's other options besides academic practice. But then of those women who enter academia, right here, only 21% go on to become a full professor. And unfortunately, I've witnessed this leak directly. So I've been at Stanford for only 5 years, and I've lost probably 10 to 15 women colleagues. Not the same amount of men leave medicine. I can't think of but 2 men that have left. So there is a leaky pipeline even at Stanford. And then of those women who make full professor, only 16% of women go on to become deans of medical schools, for example. So there's a real lack of women leadership in medicine. So this just breaks down the data a little more and goes into some of the granular details. So you can see it's interesting, there's only about 48,000 applicants to medical school. 50,000 actually go to medical school. Women on these graphs are in green, men are in blue. And then the graduates, so we lose a couple thousand from going to medical school and graduating, still about half are women. And then 46% or so of residents are women. Now, after you finish medical school, you choose your specialty, and then you matriculate into a residency. And I think this is just interesting to go over. There hasn't been much change over time. So if you look at the AAMC website, this is available to the public, actually. You can look at previous reports, and many of the same trends hold up over time. So pediatrics has a very has always had a high prevalence and majority of residents being women, so 71% of pediatric residents are women. Obstetrics, very similar. OBGYN, 83% of residents in OBGYN are women. Pathology, more than half nationwide, definitely less than half at Stanford. And psychiatry is trending over time to have more women, as is family medicine. You can see there's some specialties where women do not make up the majority. In fact, this is actually the best it's ever been. So surgical residencies and subspecialties, about a third or so of residents are women. Same for anesthesiologists and emergency medicine. And then of those women who graduate residency and go on to become a faculty member at an academic medical center like Stanford, men make up the majority of full-time faculty. So men, again, are in blue, and you'll see the progression through academics is from assistant to associate to full professor. More men make it from assistant to associate and then full. And in fact, only 20% of assistant professors are women, and only 5% nationwide make it to full professor. The data is not too different for Stanford. Now, I'm not allowed to share the exact data from Stanford, it's confidential. But I would say it's on par with this national data set. So this is a very telling slide, I think. So it compares over 5 years. So looking at around 2008 to 2009 compared with 2013 to 2014, comparison of full-time faculty promotion, hires, and departures. Okay, so again, women are in green, men are in blue, and we'll start here with departures. So unfortunately, from 2008 to 2013, we have an increase by 5% of women departing academic medicine, men decreasing. Women are also making up a little bit more new hires. We've made no progress in moving through the tenure line, so moving from assistant to associate, okay? And then, and making tenure. And then not moving too much through the academic line from assistant professor to associate professor to full professor. So, yeah, I'm glad I'm seeing head nods and some shame. I was kind of surprised by this data too. And then when you get to leadership, so dean level, assistant deans, department chairs, division chiefs, etc., the numbers are even bleaker. So this is a 10-year comparison. So we're going back to 2003, 2004, when I was still in medical school. And then the middle column is 2008 to 2009. The last darkest column is 2013 to 2014, of which that's the most recent data we have available. So what percent of women are division chiefs? It's gone up a little bit, but only about 25%. Only about 25% make it to associate or vice chair. Really, 15% of women are department chairs. That's pretty bleak. We're making progress as far as some of the educational roles in a medical school, such as assistant dean and associate dean. So we're making some progress here, as well as senior associate dean and vice dean. But only 16% of academic deans at academic medical centers are women. 16%. We've made progress, but pretty bleak. So the AAMC survey actually has also started anonymously asking women faculty what do they think they need to move forward in their career. So I think that's great. They haven't always asked this question. So women, and we actually at Stanford also participated in this data, suggested that their careers would progress if they had more clear expectations about their role and how they advance. from assistant to associate to professor, etc. If they felt they were working in an equitable and diverse workforce. And I'm going to get into this a little bit. Diversity is actually key, I think, to success for not just women, but other groups. And then they cited needing access to opportunities for development and advancement. And other folks have researched this, not just the AAMC. So this was a nice paper put out just a couple of years ago, and they sampled almost 5,000 faculty, both women and men. And in general, women had more negative perceptions than men regarding self-efficacy for career advancement. So how confident they could move through the ranks. This is very surprising. These are very smart women who are certainly capable of going through the ranks. They had more negative perceptions about relatedness and inclusion to their colleagues, so a sense of connection. They had a negative perception that their personal values didn't necessarily align with the observed institutional values, so not just what's on the website, but what actually happens at their institution. They had negative perceptions of equality for female faculty. They had negative perceptions about work-life integration, so meaning the institution supports managing both a work life and a personal life, whether that's taking care of your parents, taking care of your own children, whatever you define as personal responsibilities. And negative perceptions around institutional change efforts for diversity. So I think this study was very important and gave at least some guidance to what academic centers could do to improve this negative perception. And the AAMC survey data gave academic institutions guideposts as to what they could do to help women, help guide them from matriculation to medical school through the tenure and all the way up to full professor. So we have some starting points and we have a long way to go. So what can we do? I am a scientist after all, and I think we need more research. I think we're just grazing the surface when we read this sort of high-level survey data. And so I think more nationally, but even more locally would be important. Why do women not go into certain medical specialties? Why don't we have more women neurosurgeons, for example? Why do women leave the pipeline? We don't know. I think people are not always very candid in their exit interviews, but that information could be extremely valuable, especially to women still at an academic institution that you left. Are there other professions we can learn from? So this has hit the lay press. Where are the bright spots? How could we highlight what another industry is doing to help women in medicine? And I think a really good example that actually a child shared with me yesterday, and I thought, oh, this is perfect. We were talking about that show, The Voice. Does anybody watch The Voice? Okay, I love that show. Essentially, it's a blind audition singing show. And so they have professional singers. They are not allowed to see who is singing. Now, obviously, they know if the singer is male or female. Sometimes, it's not always obvious. And they choose for that person to continue on the show by pushing a button. And then their chair turns around and they're able to see who is singing. And it's sometimes shocking. A voice doesn't always match what a person looks like. So that's entertainment. They've figured out how to take out the bias of what someone looks like to choosing them to move on in a professional singing competition. That's pretty cool. So I was talking about that with another colleague and they said, oh, the symphony does that too. So they have had blind auditions for decades, which makes total sense. Until they did that blind audition process, women made up a very small minority of symphony musicians. Suddenly it went to over half. So other industries have figured this out. I don't think that we've looked closely enough at what are the reasons that we have bias against women in medicine to figure out what's going to work for us. What is our blind audition process in medicine? I don't know. Are there other institutions that are doing this? So I'm going to use a political example, not to spark conversation, but Hillary Clinton, her staff is more than 50% women. Somehow she figured out how to do that. So are there other universities, are there other academic specialties that we can learn from? What are they doing differently than Stanford? What are they doing differently than academic medicine? Should there be regulations around this? I'm not really gonna delve into this topic. I think it's a little controversial. But my husband actually owns his own recruiting firm. And so we have a lot of interesting holiday conversations at our house. And I'm always asking him, who's the women candidate? Who are you putting up for that job? Who's a minority? And if you don't pay attention to it, you don't put the candidate up. So he has a staff of almost 50 employees, and they always talk about who the minority candidate, who is the women candidate. We have to pay attention to those kinds of things. Are there other countries that have figured out what to do better than we have in the US? Are there other cultures that do this better than we do? I think there are some other bright spots that we can learn from. And then, are there other intangibles to retain women in academic medicine? So interestingly, there's been a lot of research around, I guess I would just colloquially call it the carrot and the stick. So what makes people work harder? What makes people more successful? And a lot of new research has come out that I didn't have time to put in my slide deck today that shows that it's not always what you think. So if you pay people more money, are they more successful? No. So there's other intangibles that I think specifically are important for women to stay in academics. And we need more research around that. I don't think that more money is going to solve this problem. What about at Stanford? So I'm actually proud to be a faculty member at Stanford because the dean and the School of Medicine are very aware of this leaky pipeline. And it starts before those kids go to medical school. So I think we all as a community at Stanford do a very good job of, I do this a lot, coming to talk to groups of middle school kids. I did that here about 5 years ago. Getting women interested in the sciences, getting them into the pipeline to begin with. So I think Stanford does a really good job of outreach in the community. And the dean's office actually has an office of faculty development and diversity right in that School of Medicine building. So they are paying attention to this every time they're recruiting a new faculty member. I've sat on many committees where we're trying to hire someone, not necessarily even in the School of Medicine. There's always a woman candidate. There's always a minority candidate. We are always looking at this. And in general, compared to a lot of academic institutions, Stanford has a lot of family-friendly policies, which are not important just for women. And I think that's also a key that you'll see when I talk a little bit more about my personal situation. It's not necessarily Stanford's policies that are benefiting me. It's actually my husband's business that's benefiting me because he's able to do things when I'm working at the hospital because he has a very flexible work policy. He owns the business, so he made the policy. That's very, very lucky for me. Not all women are in that situation. Stanford has very generous parental leave policies, and that includes not just having your own child, but adopting children, which I think is very progressive. And in general, Stanford has a very respectful work environment, which is not always true in academics. And I think the dean has really developed that, and so have the president and CEOs of both Stanford Hospital and Lucille Packard. They really don't tolerate bias or disrespectful behavior, even in pretty high stressful situations like emergency rooms and the ORs. They can get really stressful. Department chairs, et cetera, don't tolerate sort of angry behavior, which is very important. So this is just a sampling of some of the services that Stanford University offers to all faculty and staff. So they actually help out with on-site childcare and even off-site childcare. They have a lot of resources around adoption. They have backup care. That's fabulous. So when my daughter is sick at school, I can easily use this backup childcare. Or now, actually, Stanford's really progressive, and I'm trying to model to my residents and interns and learners. I sometimes bring my daughter to work. She can round with us. No big deal. She sat in her stroller when she was 6 months old, And we went and saw all the patients that I needed to see that day. Certainly she didn't have the ability to share any of their names or confidential information, so that was okay. But what I'm trying to model for the residents and learners is I want this to become normal behavior. Now my mom, not that long ago, could never bring us to work. But now I know teachers where that's not discouraged, and other teachers will watch children in the break room. So we have to normalize some of these things to make our lives easier. They actually have a lot of wellness activities at Stanford. We are very, very advanced when it comes to physician wellness, actually. So we have some of the world's thought leaders on that working at Stanford School of Medicine specifically. And I'm just going to highlight one great wellness initiative that specifically had to do with pediatric hematology oncology, which is a tough field to sometimes be in. We deal with children that have very serious illnesses, and some have a very high mortality rate. So we are really dealing with pretty tough social situations. We participated in a pilot that Hannah Valentine, she was the PI. She unfortunately left Stanford and went to the NIH. But the write-up in the New York Times was about the pilot in the emergency room doctor group. Ours was the same incentive pilot, but what we did essentially is we got credit for trading shifts or doing things that colleagues in HEMONC do all the time. Let's say I had a patient die, or I had a really tough conversation about a relapsed cancer diagnosis in clinic. And I just go out to my partner and he says, you know what, I'm gonna cover the pager tonight. Just go home, be with your family, take a rest. He would get credit for taking that pager for me. And we were able to exchange these credits for everyday behaviors that kept us well, to be honest. And we could trade them in not for money, but for awesome stuff like Uber credits, or Munchery credits, or life coaching, or cleaning up presentations, making them really snazzy. So that credit thing was pretty awesome and meant more to me at the time when I had a very young child. It was so awesome to just punch in what I wanted for dinner and it just was delivered to my house than a raise could ever have meant at that time. So that was a really cool thing, very progressive, and really helped me stay well and my family stay well. So I thought that was a pretty cool thing. We're still giving each other credits, but now I have so many I don't know what to do with them. So I have like 300 credits, which is like 1,000 Uber rides or something. So I'll get through them eventually. I think it's important to note that there's other bias in academia. And I didn't have time to touch upon this, but there's been some really enlightening studies that have also hit the lay press. So there's definitely disparities in how women are paid, even in medicine at the same position versus their male colleagues. And to me, there's no reason for that at all. Certain companies are now addressing this, and I think President Obama is trying to address this in various ways. I'm not going to talk too much about this because it's a little controversial on how to do that, but if two physicians are serving the same role, it really shouldn't matter what gender they are. They should get paid the same. There is sexism in peer-reviewed research. So there's been some really interesting things where people have shown that if there's a publication, there's many more critiques if all the authors seem like they have women names, versus maybe the same exact publication but has male names. It sails straight through the reviews and is easily published. That needs to be addressed. There's sexism in letters of recommendation. So similar studies have shown the same thing. The same letter for male Dr. X is viewed differently as the exact same recommendation letter for female Dr. Y. Female doesn't get the interview at an academic institution, but the male resident does get the interview. So there are ways that we can address this, and I think academia in general, I hope, is going towards this. Science, any field in science, is aware of this publication bias, and I hope that we're moving towards maybe blinded review. That seems completely reasonable, and I think we're borrowing from that bright spot of the symphony. And I think this is a really important concept that I learned about when I was researching this talk. So it's very important to model possible selves for girls. This is a concept in psychology, sociology, but essentially the concept is a girl who never sees a woman in a position of power, like a CEO or a physician or a fireman. She can't easily construct herself ever being in that role. And that is critical. I think about my patients and my daughter, and I want her to be able to imagine every possible self. I want these kids to think they can literally be anything they want to be. Now, I think in Silicon Valley, we actually have some very strong women, and that's great. But this needs to be across the board in every position, every occupation, not just physicians. So a little bit personally, what has helped me? And so I'm going to steal a little bit from Sheryl Sandberg. I have the world's best husband. He is extremely supportive, and he owns a very family-friendly business, which allows me to work 50 to 60-hour weeks. He can pick up my child at preschool and drop her off in the morning, etc. So his family-friendly business policies benefit me. I have very supportive colleagues. I happen to have, in both divisions I work in, women division chiefs who both have children. So they're very understanding of, oh, my daughter got sick, I need to run out. My male colleagues as well are very supportive, especially at the Children's Hospital. And some of them have watched my daughter in the physician workroom while I'm seeing patients. So that's amazing. I think the values of my friends and my community here are similar. And I hope that I'm modeling these values for the next generation. Not just the children and my daughter, but also the next generation of physicians. So the interns, the residents, the fellows. I'm trying to normalize some normal mom behavior at work. And so what can you do to take it down to the local level? What can you granularly do in your everyday life to help support women and hopefully take out some of the bias? So support the women in your life. Remember the concept of possible selves. So think about your daughters, your wives, your aunts, any woman in your life, your cousins, and support them as best you can. Whenever and wherever you encounter a woman, be aware of your unconscious bias and how she might view your comments or actions. And I think this is easy to see. So I remember this one particular veteran when I was a medical student at the VA, and he said something to me along the effects of, "You're too pretty to do this," or something like that. And I just said, would you ever say that to your granddaughter? And he sincerely apologized. Of course he would never do that. He would never belittle her looks for what she knows, what her intellect, right? So if you just bring it down to the personal level, I think that everyone, women included, probably say some things to other women that they don't think about. So just be aware of your bias. And I think all of us as a society are becoming aware that we need to support work and policies that are not just women-friendly. I hate that some of these issues get labeled as women issues. Childcare is a parent issue. It's not just a woman's issue. Why does my life work? It's because of my husband's work policies, not necessarily Stanford's work policies, which are actually pretty good. So I think we should all just as a society think about these things and support as best we can policies that are family friendly. So just to conclude, I think everyone's learned that we all have implicit bias. Medicine has a shocking leaky pipeline. We need to do more research, not just nationally, but also at the local level, to figure out why women are leaving. And Stanford is a real standout. It's a real star when it comes to their supportive work-life balance and family supportive policies. It's very progressive. Their physician wellness I've definitely benefited from, so I think we should continue to support that work. And I think we need to think about strategies that support women globally. And start with the individual, so start with the women in your life, and then how do we move that into a more national conversation or maybe even policy. So I just want that last question to be a little thought-provoking, and I hope I can answer any questions you guys have and have a little back and forth. So thank you.
Hold it pretty close.
Your example of the basketball players
Yes.
and the gorilla is not an example of bias at all. It is a simple example of misdirection.
Yes.
It is exactly what magicians rely on.
Yes.
So I think it's a bad example to lead your talk off with.
Okay.
There's no bias in that at all.
Okay.
Okay, that's what I want to start with. Who's next?
So I really enjoyed your talk about how women are not represented equally in medicine, and I definitely agree with the fact that it is an issue, but there are a lot of people in our society today, even in politics today, it's very prevalent that some people do not understand why this is an issue or that this is even an issue. Mm-hmm. How would you address that, and how would you make it a known fact in society today?
Oh, that's a great question. Well, I think I could use medicine as an example. So we're actually learning that maybe in medical school I should have learned that there was a difference in physiology, for example, in drug metabolism between men and women. So I think the pharmaceutical industry is catching on to this. Women and men actually do have some different responses to pharmaceuticals. So I think if we don't have women at the table at that conversation to design those clinical trials and think about those kinds of things, we're going to miss big insights. I also just think in general, more diversity is better. Better ideas, different ideas, people of different backgrounds. That kind of brainstorming and creativity as a group just breeds much more provocative and interesting ideas than just the same people sitting around a table bouncing around ideas. So I think diversity, which includes women, really can probably bring more insight to medicine. And I think that we just have unrealized potential. Half of our society, actually more than half, is made of women. And so they need to be at the table. So I think there's some very specific examples I could give for pharmaceuticals, and we miss that. We, medicine in general, for decades, we didn't study drugs in women at all. We just studied them in men, and now we're starting to realize that was a mistake. So that's a good example that's very objective.
I see a couple of problems in correcting this. The first one is that a man is evaluating subordinates, let's say, and downgrades a woman, and the ostensible reasons are, well, you're not doing as well this, that, and the other thing. And it's on an individual basis, so you can't say, gee, he's picking on women. So it's a one-at-a-time thing. It's only when you get it in sequence that you can see that, gee, he always seems to be putting on women.
Right.
The second aspect is that people have a subconscious tendency to look at other people in comparison with themselves. So a man is going to look at other men as being more equal than as a woman. It's not a good thing, but that's the way that it seems to work. And I think it's going to be very difficult to get that erased or get that lifted up so that they're really co-equal.
Right.
It's not easy to do. And I remember years ago when the manager of our department was promoted and was a woman. And I came up to her and told her how glad I was because I'd seen her work and thought she did a very good job. And she was shocked because nobody had ever said, gee, you really think I was promoted because I'm doing a good job?
I think you're right. I think this is a hard problem to tackle. What I see, though, because I work with children every day, is that I think some things, let's say, for example, in my grandparents' generation, it was normal to view people of color in a different light. Children don't do that. My daughter now, so in this current generation, doesn't even think that her best friend is darker skinned and Indian, right? So I think that over time, as we normalize that there are diversity and women, that thought process of comparing yourself to another man, you won't think about that anymore. The newer generations, the kids are going to help us solve this issue, really. Yeah.
I'd like to offer your thought. I taught at San Jose State, and we would often get into this subject, and I'd ask typically the young men in the audience if they worked on their cars, and most of them said yes. And I said, well, consider, before you go to work on your car, going to your toolkit and randomly throwing out half of the tools. Randomly throwing out half of the tools.
Right.
Would you do that? And they said, that'd be dumb. And I said, then why aren't you willing to consider the half of the capability of the world that is represented by, women or minorities?
Right.
And it got the point through without it being too abstract.
Yeah, that's a great analogy.
Okay.
I love it.
A question, as you see women go into positions like deans and the like, are you noticing that they carry biases into this?
Oh, that's a great question. So I know one of the associate deans in the School of Medicine quite well because we're in a similar profession. I think that she knows her biases. That's a wonderful question. I'll have to explore that with her. For what action does that mean? How does she correct the biases that she knows she likely has?
My fear is
Yeah.
that as you move into what have been traditionally men-dominated positions, will you adapt a men's view of it and in effect perpetuate the biases that you've been trying to work with?
That's a good question. I'll have to ask her. I think it's a fabulous question.
I'd like to add two comments. First, you didn't describe all the circumstances surrounding the comment that you received, you're too pretty to do whatever you were doing. If I made that comment to somebody, it wouldn't be a criticism, it would be an offhand compliment saying, you are pretty. It would be perhaps even a come on line, but it certainly wouldn't be, oh, you don't deserve to be doing that because you're a woman.
Right.
It is instead just saying, oh, you are pretty. Second, you lamented that only, what did you say, 16% of the most recent statistics of women are deans.
Right.
But you ought to celebrate that because the previous statistic was 10%. So
Right.
you've increased 60%
Right.
in
10
5 years. That's something you should celebrate,
In 10
not
years.
lament.
Yeah.
Well, you had
Yeah.
3 things there. Even so, 60% is an amazing increase.
We're making progress. I think that we have a lot. We have room to improve. Yeah. And I would just ask you, would you ever say to a male physician who came to your room, wow, you're very handsome? And I don't think that anyone would.
I'm heterosexual.
I know, but I just
so
don't
I'm
think
not
it's
gonna do that.
I just don't think it's an appropriate comment that has any space in dealing with a professional. So I'm heterosexual. I would never say to my male accountant, you're very attractive. I mean, it just isn't an appropriate comment. So, okay.
How does a colleague pay you a compliment then?
Oh, certainly colleagues pay me compliments. I like your dress today, etc. Yes. Well, so my patients are children, so they
I'm avoiding the question. How
Yeah.
does an adult male pay you a compliment if he's a patient?
I think sincerely, and I don't have adult male patients, so go ahead.
My friend and I have been members of the American Association of University Women for quite a while, and one of the things that we do is research. And there have been several pretty praised studies come out in the last several years on the lack of women or the problems that women have in leadership and the problems that women face in STEM, and particularly pertaining to getting the jobs and retaining the jobs. Our focus now is to a great degree around the country on girls in middle school. This seems to be a very important target. And we locally were one of the first branches in the United States to start a summer STEM camp
Oh, great.
for middle school girls here at Stanford.
Yes. Great.
So if you can get the right mindset when they're young,
Yes,
there is hope.
I agree. Thank you.
But I would really urge people to check out A.A.U.W. and some of the research that's been done. And in terms of women not being comfortable in moving out of even good paying STEM positions, a lot of it has to do with their uncomfortableness in the work environment. So a lot of things to explore there.
Yeah, great. Thank you. This was a new topic to me, so I'm happy to speak with you afterward to maybe get some references. So thank you.
Yeah, just to add to that, we have tours that we do in the summer for the Tech Trek Science Camp sponsored by A.A.U.W.
So I
And
actually did that. Yeah,
it-
5
very,
years ago.
absolutely. Dr. Andrews gave a very entertaining and inspiring talk to the girls. So yeah, we support that 100%. They'll be here with 2 tours this July.
Yeah.
So thank
It's a
you.
great,
It's
yeah, great program.
great kids, and it's a lot of fun to do it.
Yeah. Agree.
So if you're teaching kids about science,
Yeah.
the word that was used was girls. Do you separate them out?
So I specifically actually did participate in an event just for girls, but I also do actually science talks for classrooms of obviously anyone who's in the classroom. Yes. But I think all children in general need encouragement. So certainly I can think of lots of examples of kids that needed a little push in their academic work. Obviously that includes boys too. Yeah.
Do you know Myra Sorbel? Have you seen her book?
No.
She's Emerita School of Education. She gave a great talk. I thought it was great. And it starts off with, she was working at Berkeley, and the dean had just told her that she didn't have a prayer of being tenured because she was a woman.
Oh.
And that was back in the 70s.
Ooh.
And she's an economicist, and she studies the role of women in economic viewpoint. It's a great book, and she's around. You should have her for lunch.
Yeah, I would love it. I'll meet you after and get her name. Thank you. All these suggestions are great. Thank you. I learned actually a lot researching for this talk, so I'm happy to learn more.
Yeah, I was wondering, what comes to mind about the leaky pipeline is that women may be electing to raise a family, and they might find that more intrinsically meaningful than being in a professional setting working. Is that something that comes to mind?
So interestingly, I didn't read too much research about where do the women go. I don't know that we know where the women go. It may be known in other kind of higher academic circles, but anecdotally, the handful of women that I know who left academia did not leave medicine. So just specifically, academic work is very vigorous. It takes a lot of hours. You're not well compensated compared to being a physician in private practice. So maybe some of those factors were a role, but just me personally, the women I know who have left academia did not leave medicine. So they didn't go home to take care of their children, for example. I think a lot of work has been done in this area, just in general in society. What are women doing? And child rearing is obviously very important, and for women who leave the workforce, just in general, it's actually tough for them to get back into the workforce. So my husband has lots of anecdotes about professional women in STEM professions who were, very well accomplished, maybe took 5 to 10 years off to raise their children and had a very difficult re-entry into the STEM workforce. So I think that issue is, we really need to explore why women are leaving. It's a good question.
Thank you. This has been very interesting. I think that in medicine, you're just touching the tip of a very big iceberg.
Yeah.
If you look at the relative ways that women are treated in business in manufacturing, in almost any other profession, even a professional level. My wife is a civil engineer, worked in construction all of her life in a South American country, which has more than its share of male-oriented folks.
Right.
It wasn't easy for her.
Yeah.
I was head of a company. We had manufacturing people. We had various types of business-related people. And we really tried to keep people level. And I think at one point we had more women supervisors and managers than men. But that was only for one period of time. But the other point I wanted to make is this is a multi-generational problem. When I grew up, when I was a little kid, my father had different ideas about how you not treat women, but how you relate to women. And my father was a nice guy. But, you know, he was born in 1904, and his father was born in 1870. So I don't think it's going to take another 100 years, but I think we're on the right track. And I think there's a whole lot of other industries, this is not an industry, there's a whole lot of other professions, people that need a lot more pushing to get women there. And I would look at Finland and Sweden, at least two countries that we know of that really seem to have figured out how to keep things very level.
Yeah, that's a great suggestion actually, and that's why I put in kind of where are the bright spots, who else has figured this out? Because I read some in the lay press, and I think some of those very family-friendly policies are in those European countries that you're referring to. And I think that just in general helps women stay in the workforce. So that's a great point. And kudos to your wife for working in, I would say, very loud society. Oh man, I've spent some time down there too, so that's amazing.
I would encourage you to look at Israel. They have a unique situation. It's mandatory military service for all men and women. And I think that may be a leveler at an age that would carry a reduced bias forward.
Interesting. Yeah, very interesting.
Sorry, I wanted to maybe ask if you agreed regarding the comment about paying a compliment to a woman. Just whether you would be able to pay a compliment without at the same time questioning the intellect of the woman.
Sure,
Like,
yeah. I think
that was maybe the main problem with the comment.
Exactly.
Right? Because in the same sentence,
exactly, that was my issue. I think a sincere comment on my appearance, I'm not like...
Just not in the same sentence saying
Correct.
you're too pretty to...
Correct. And I would say the other kinds of comments are more common, so I still get to this day, when is the doctor coming?
Yeah.
Almost on an everyday basis. And it's not from the children, so they know I'm their doctor. It's their parents or their grandparents. So I actually really think there's something to your comment that this is a generational issue that actually is gradually getting better, and I see a lot of hope in the children. I really do. I think we're going to solve this, and the younger generation is going to help us do that. I mean, and Stanford's a leader, so yeah, I think without the other implication that I wasn't smart enough to still be their doctor was my main offense at those kind of comments.
Yeah. I also wondered if you had some thoughts about why there is an income discrepancy between men and women, whether
That's
that might
a great
have...
question.
I'm in academia myself, and
Yeah.
I think if part of your if your salary is sort of merit-based and your research
Right.
slows down when you start having a family.
Right. So there have actually been some studies that I didn't reference here that actually control for that kind of thing, like a slow down to take care of family, etc. Even when you control for those periods of time, women are still paid less in academia. On average, somewhere like 20% less. I mean, it's pretty significant. And I didn't think it happened at Stanford. Oh, maybe someone knows the percentage. Yeah.
There's been a lot of studies where women just don't negotiate. They accept what's offered to them, whereas men,
Correct.
it's a point of pride to negotiate.
Correct. But there's something else to it, though, besides negotiation. Just to share an anecdote. So many physicians after their training, so after fellowships, enter institutions like Harvard or Stanford at something called an instructor level, which isn't on any of those slides. It's sort of this role where, I won't describe it in detail, but essentially it's a more low-paying role as an attending physician. There's no negotiating involved for salary at the instructor level. Surprisingly, I know men and women instructors in the same field who are paid differently. So in my mind, that's inexcusable. There's no reason for that. So I don't know. I don't know if anybody knows the answer to that question. Why are women paid different? I don't know. So I will.
So I was recently reading about that, and there was a study that showed, it was, in my opinion, someone playing the devil's advocate in that issue, but it basically said that women tend to choose to pursue family paths and choose to step down from positions, also leading to the leaky pipe situation, I think you referred to it as. Mm-hmm. And going back to your comment about how it shouldn't be just women stepping down from their positions to take care of children, you said it was a parental issue.
Yeah.
I completely agree with that, and I think that is how it should be viewed when looking at that issue. Like, even if it is women that do step down or leave their jobs for a period of time to take care of children, it shouldn't be that way. Like, for some issues, understand, like, only mothers can take care of it.
Right.
But if it is raising a child as a parental unit, that should be compromising to make that issue.
Agree.
So.
And I think there's other countries that do this really well.
Right.
So I have friends that practice medicine in Canada, and their parental leave policy is very generous. And not only did my girlfriend stay home, but my friend, a man from residency, he stayed home with 3 of his children in Canada for months. So I like your comment. I agree completely that we should frame this as a family issue. It's not a woman issue, it's a family issue. Yeah. You guys are such an interactive audience. This is great. During the Warriors game, I'm thrilled.
Great. Well, thank you very much for a really
thank
fascinating and thought-provoking talk.
Thanks.
Appreciate
This
it.
was fun. Thank you.